Okay, and welcome to the Davies Use Case webinar being presented by Memorial Hermann on improving quality outcomes by addressing gaps in care. This is the Davies Award-winning use case for the value of health IT. My name is Arnold Simmons. I'm the Manager of Quality and Patient Safety here at HIMSS, and it's my pleasure to moderate this presentation. Core to the HIMSS mission is promoting the use of health information and technology to improve the quality of healthcare delivery. HIMSS promotes and advocates the integration of clinical decision support and best practice guidance, access to clinical data to analyze progress, and information and technology-enabled patient safety tools for all healthcare organizations, clinicians, patients, and community members as vehicles for improving patient outcomes. The HIMSS Nicholas E. Davies Award of Excellence is the pinnacle of the HIMSS Value Recognition Program. The Davies Award recognizes outstanding achievement of organizations from around the world who have utilized health information and technology to improve patient outcomes and value. The Davies Award-winning use cases have been peer-reviewed to validate sustainable, improved patient and business outcomes resulting from health information technology-enabled care delivery. So it's my pleasure to welcome our speaker for today's webinar, Ini Akiko from Memorial Hermann. Ini, I will turn the presentation over to you, and you can begin when you're ready. Thank you.
Thank you, Arnold. My name is Ini Akiko. I'm the Associate Vice President of Population Health here at Memorial Hermann. Today I'm going to walk through some of the different things we've done at Memorial Hermann from a people process technology viewpoint to improve our quality outcomes while addressing gaps in care. After the Affordable Care Act in 2012, Memorial Hermann created an ACO. This ACO allows us to integrate our very pluralistic physician model that helps to drive to various quality outcomes. You'll notice on this slide that like a lot of other organizations of our size, we traditionally have been a fee-for-service organization with over 15 acute hospitals in the Houston, Texas market. And we have a vast ambulatory footprint as well. However, as a part of our ACO, we really needed to bring together our three different distinct physician practice models. Here at Memorial Hermann, we have our employed physicians, which are a part of our medical group. We have independent physicians, which are a part of our MHMB group. And then we have a partnership, a faculty partnership in our Texas Medical Center with UT Health. While leveraging our population health infrastructure, we are using Cerner's Healthy Intent platform and the various applications that sit on top of Healthy Intent to truly get the data that we need to drive to quality outcomes while managing cost. Here at Memorial Hermann, our mission is to advance the overall health of each individual and population through innovative technology solutions that drive preventative care and evidence-based disease management. These solutions are powered by claims and clinical data derived from multiple data sources that generate a master person record by placing these tools directly within an EHR workflow, that gives us quality performance and also physician integration, which I need to start over on this slide as well. Here at Memorial Hermann, our mission is to advance the overall health of each individual and population through innovative technology solutions that drive preventative care and evidence-based disease management. These solutions are powered by claims and clinical data derived from multiple sources that generate a master person record. This is done by placing these tools directly within the EHR workflow. Quality performance is improved, physician integration is strengthened, and cost is reduced. Our population health platform comprises of various data sources that feeds Healthy Intent. Various data such as EMR data, paid claims data, or on-site biometrics data. The various EMR data that's feeding our Healthy Intent platform today is Allscripts, Athena, Cerner Millennium, ECW, GE, and Point Click Care. We also have paid claims data from payers within our ACO. We have enrollment data and claims data coming from Aetna, Blue Cross Blue Shield, CMS, Humana, our own Memorial Hermann Health Plan, and United Healthcare. To support our wellness programs and initiatives, we also collect on-site biometrics data for our employee and or employer solutions initiatives, and that data is also fed into the Healthy Intent platform. Once the data is on Healthy Intent, this data is scrubbed, normalized. The data goes through a transformation process where there's truly one patient, one record. Based on all the data in Healthy Intent, this data is pushed to various different end users via different applications. We leverage algorithms to support it. We use analytics. And then we also here at Memorial Hermann have a consumer app called Everyday Well that allows our consumers to get truly a full picture of how they could manage through our hospital system, from booking an appointment, paying for scheduling a visit, paying a claim, etc. And our Healthy Intent platform and the data within Healthy Intent helps to power our consumer app called Everyday Well. Some of the applications that we have on the platform today is our registry application, which we'll do a deep dive into in a little bit, our Healthy Care application and Healthy Record. Then we have various algorithms such as Sepsis, a transition of care algorithm, our readmissions algorithm, HCC, suspected algorithms, 3M, and Truven algorithms, which are used in the analytics space. So within our Healthy Intent application, we have payer data, clinical data that come from our HIE, clinical data that comes from EMRs, and biometrics data. This slide really showcases the vast data sources that can feed into Healthy Intent, be it payer data and the various types of payer data that you could get, clinical data coming from an HIE, where you would be leveraging CCDs, and or clinical data that could come from an EMR where you leverage daily extracts, and then biometric data to support wellness programs. So we'll quickly do a deep dive into registry, and we'll talk through the different registries that we have set up here at Memorial Hermann and some of the outcomes of what we've seen through this registry app. So Healthy Registry is a Cerner product that is powered by their Healthy Intent platform. The registry application creates a single person, and the record is leveraging 40 different data sources, be it payer claims data and or clinical data. Patients are placed into different registries based on certain health conditions, and it also allows clinicians to manage and improve the overall health of a population one person at a time based on a visit with a clinical end user. The measures within registries are heavily driven by our CMS ACO measures of excellence, but here at Memorial Hermann we have a handful of Memorial Hermann custom measures based on our governance committee. We have 15 specific registries rolled out here at Memorial Hermann. There's registries specific to adults and or adolescents. Most folks would fall into a minimum of one registry, be it an adult and or senior wellness registry or a pediatric wellness registry. And the other registries would be based on any inclusion or exclusion criteria based on the various data sources that we have on our Healthy Intent platform. This slide showcases, based on the different registries we have, all the specific measures associated to each of those registries. So today we have specifically 98 measures that span across one of the 15 registries. From a registry governance perspective, we have a registry governance model that spans across our MHMD independent physicians, our UT, our faculty partnership physicians, MHMG, our employed physicians, and then also our IT area is a part of the registry governance. The Registry Governance Committee was established back in 2017, and it was important for us to ensure that based on our physician model that we had representation and stakeholders across the organization to ensure alignment in the registries and or the measures that we would be rolling out for the system, and then also to ensure that we got positive feedback from physicians that are practicing and of what is working or what would need to be improved upon. Some of the major decisions that have come out of our governance committee is a diabetes algorithm update. What we also manage through this committee is onboarding of new registries and or measures. We also validate if a measure needs to be retired because it's out of date, that comes through the Registry Governance Committee. And then any future rollout strategies that we have with expanding registries to different specialists and or different groups across Memorial Hermann. This is a committee that meets monthly and allows for us to get consistent provider feedback on where we're at today, what needs to change, or any workflow standardizations that we would need to be focused on. One of the things we noticed at Memorial Hermann after rolling out our Healthy Registry application is that there at times needs to be a loop of continuous improvement to validate that you have eyes on what's been rolled out, what's working, what's not, and any changes that may need to take place. We rolled out, for example, our adult diabetes registry in July of 2016. What we noticed pretty quickly after rolling out the adult diabetes registry is that we had a significant over-inclusion of patients that were included into this registry. Through various teams and physicians, PCPs specifically, they noticed that they had individuals or patients falling into the diabetes registry that weren't truly diabetic. Based on further research, we were able to uncover that if a patient had an inpatient stay and had insulin during their inpatient stay, that because of that insulin and the data that was within the Healthy Intent platform, that was automatically qualifying patients into the diabetes registry. So in July of 2016 is when we did a revamp of that algorithm to truly validate, do we understand who's qualifying, who's not, and who should qualify, and making the necessary updates at that time. Based on that, the updates that were done at that time, we noticed that the population of adults with diabetes decreased 37%. In phase 2, in July of 2017, we went back to look at the visit concept and the insulin medication concept to ensure that we were truly operating as we should, or what we were expecting from a clinical perspective, and were able to clean up the inclusion-exclusion criteria for adult diabetes, and we were able to decrease that population by another 9%. This really just shows that at the point of rolling out any registry and or specific measures, it's important that from a clinical end-user perspective, that the feedback that you're getting from physicians is being looked at the platform level to ensure the accuracy of what is being front-facing to your clinical end users. And this is an example of how over time, getting better at what is being put in front of our end users and our clinical staff. From the time we rolled out registry in 2015, we rolled it out with 12 registries and 60 measures. And through the help of our governance committees and the various physician end users, today we have 15 registries and 98 measures. So this is just showcases over time, and specifically over time and in the strategy of your organization, how the types of registries that you have and or the number of measures you have within registries can grow to truly help to focus your organization on the quality program that your organization wants to be focused on. From a data mapping perspective, we truly believe that this is the process that needs to be taken from loading data onto the platform and validating the accuracy of the data that's on the platform. Various teams within our IT shop ensures that a workflow analysis is complete. Then we do concept mapping with the Cerner team. Then we use a Cerner tool called the Data Intelligence Dashboard to do validation, and then we complete all that with a workflow validation that's provided. So what does that actually mean? From a workflow analysis perspective, prior to rolling out any registry and or measures specifically, we go back into meet with the physician's practice, understand what is truly the physician's workflow within the EMR. What is it that they're documenting? How is it being documented? So we know how to pull the data out of the EMR effectively and how that data should be mapped on the back end. After we understand the physician workflow, the physician documentation habits, then we move forward with pulling out that data, extracting out that data from the physician's EHR, and going to the next step of concept mapping. Concept mapping truly means a concept is made up of hundreds of codes, and based on the physician documentation and the data coming out, how do we ensure that the codes are mapped appropriately? The way that we validate that what we expected from understanding the physician's workflow to getting that completed from a concept mapping perspective, the Cerner team, there's a tool called the Data Intelligence Dashboard. The Data Intelligence Dashboard truly helps us to see that the data was mapped in the way that we expected it to. So you validate each map code hits, it's presented in the dashboard as expected to ensure the accuracy of how the data is being pulled out of the physician's EHR. Once that's complete, there's pretty high confidence that if a physician documents in the standardized perspective, the data could be pulled out of the EHR in a standardized way. Then that data would be loaded into the Healthy Intent platform to help ensure that the specific data would be closing any gaps of care and or addressing any quality gaps, HCC gaps, or anything that needs to be addressed from a quality perspective on the Healthy Intent platform. We also, after we go live with new physician practices on the registry application, we ensure that we do quality checks over time just to ensure that the way that the physician is documenting, the way that the data is coming into the Healthy Intent platform is closing specific measures and or HCCs or quality gaps in the manner that we would expect it to. So this is a living process of validating you understand the workflow of your physicians, that the data is being loaded onto the platform accurately, and then validating that as well. And then the importance of workflow standardization. It truly looks like if, from a clinical stakeholder perspective, if a workflow is being optimized in the way that a physician is documenting, we would be able to get the discrete data out of the physician documentation, which will allow us to close specific measures, be it if the data is coming from a scanned document and or coming discreetly from for example, documented procedure history, that we would be able to get that discrete data to allow us to close measures. Today, data needs to be provided in a discrete way and loaded onto the Healthy Intent platform to allow the completion of a registry gap and or an HCC gap, for example. In the future, if physicians have documented in a free text way, we are looking into leveraging an NLP engine to allow us to get to the data that a physician documented in a free text manner instead of the doc only being able to leverage discrete data. This really showcases how an integrated workflow works. Today, for example, if a physician was supposed to document breast cancer screening and they documented that in Cerner Millennium and or an ECW EHR and or an Allscript EHR, all that data based on it being documented discretely within these independent EHRs, that data would flow into the Healthy Intent platform and it would close the breast cancer screening measures. Based on us being able to capture that data on the Healthy Intent platform, that measure for breast cancer screening is closed, it satisfies various quality programs in terms of HEDIS, MSSP, STARS, our various ACO payer contracts, etc. So following truly an integrated workflow based on documentation, regardless of the EMR that you're in, it allows us to leverage the data in the Healthy Intent platform to satisfy multiple quality programs. Outside of just having the registry application, we have the ability to kind of stair-step our way into the tools end user could use in a physician practice. So outside of registry itself, we have a point of care report. The point of care report truly showcases the data that's within healthy registries in a format that physicians can print and room with, and or if they don't have an embedded solution that they could leverage to be able to see any gaps of care that needs to be addressed during a patient visit and or any HCCs that need to be attested to. For our physicians that are within Cerner Millennium, CareFor's Memorial Hermann's branding of the Cerner solution, this truly shows how smart registries can be addressed and are actionable via the recommendations module. So, for example, this shows that this patient had a breast cancer screening measure that was open and that was not addressed, and it's actionable based on what's within that red box that an order for a mammogram could be placed, which would help to satisfy this measure. Physicians also have the ability from within their EMR to launch the web application of healthy registries. When they launch the web-based application of healthy registries, this shows them various measures for this patient that have been achieved, not achieved, has been performed, and or is open. For physicians that are on an EMR that is not Cerner-based, they also have the ability to pull in the registry gaps and or HCC gaps via a registry API off of the Healthy Intent platform. So this is an ECW integrated workflow where an ECW physician, based on a patient visit, would be able to understand any registry gaps that were open or any HCCs that needed to be attested to via the registry API. And this registry API showcases the risk score, the quality score, measures that have been met and or not met based on the different color coding, and any supporting facts that would give the physician insight into why a patient fell into a specific registry. This is another viewpoint for an Allscripts workflow. So similarly to ECW, within Allscripts, a registry call could be launched via an API on the Healthy Intent platform to showcase what gaps of care and or HCC that needs to be addressed during a patient's visit. Long-term at Memorial Hermann, we want to move away from API calls when necessary and use a Smart on Fire app. Cerner has a Smart on Fire app called Healthy Insights, and Healthy Insights is very similar to the registry application, and or if you were to leverage the API, outside of it being within a smart container, it shows the various registry gaps and or HCCs that would need to be addressed during a patient's visit. So some of the key lessons learned that we have uncovered during this journey is validation is the key to success. Here at Memorial Hermann, we believe there's no such thing as too much validation. So we say validate, 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 and even validate some more. Specifically when it comes to payer claims data could come in different formats, styles. It could change month to month. So it's critically important that you put a process together where you are not just validating to the point of go live, but validating through the process of getting new data and onboarding new data onto your Healthy Intent platform. Also, the emphasis on standardized workflow. We truly believe a lot of the success that we've seen here at Memorial Hermann is that our physicians, prior to us launching this registry application, there was a lot of emphasis on optimization of the physician documentation. So because physicians had a standardized workflow and standardized documentation, it allowed us to understand where are physicians documenting for us to understand how do we get the data out of their EMR, accurately, then mapped appropriately from a Cerner perspective to ensure the accuracy of the data that would be front-facing within our Healthy Registry application. Then it's important to understand the mapping processes in terms of the different proprietary codes, the standardized codes, concepts, etc. That understanding the nuances between each of that would serve you well in regards to how do you ensure the accuracy of the data is being loaded onto your platform. We truly believe keep customizations to a minimum. There's clinical standards versus custom measures. The reason why we recommend keeping customizations to a minimum is because each of these measures are updated often, or at least you could take a registry update once a year. And the more closer to standard you are, the easier it would be to keep up with the updates that are necessary to keep your registries and or concepts up to date. And then consistency across components. It's critically important to us that regardless of if this is a Cerner Millennium physician or an ECW physician and or an Allscripts physician, based on them leveraging the same data within the Healthy Intent platform, we want to ensure that the way that we push the data back into a physician EMR is they see the same thing to ensure the accuracy of what is being produced back to our clinical end users. Slide number 25 kind of just showcases the timeline of what we have done from an application perspective and or an analytics perspective to support our registry rollout to our physician group. So we began onboarding data in December of 2014. and we went live with our first registry application in June of 2015. So from December to June was the time that we really focused on how do we get data onboarded, how do you get the data onboarded accurately, how do you understand what the physician's workflow is, what are the nuances within physician's workflow based on the various different practices to ensure that we knew how to leverage the registry application from a data perspective, but also an end-user perspective as well. Then you can just notice throughout from December 2014 to truly where we're at in May of 2018 of bringing on the point of care report for ECW or Allscripts and or getting integrated within various EMR solutions, so it is an integrated workflow so they don't have to go out of their workflow to leverage their registry application. On top of that thick black bar, you'll see some of the things that we've accomplished from an analytics space. I'll quickly move into analytics next of what was going on from December 2014 through October of 2017 in regards of analytics supporting our quality outcomes and our registries as well. So Smart Analytics is Memorial Hermann branding for the Cerner Analytics solution. So Cerner's Healthy Intent platform, we kind of spoke about that earlier, has over 40 different data sources here at Memorial Hermann. That's comprised of both payer and clinical data. All the large data is processed through a normalization engine called Hadoop. And the data is made available through Business Objects or Tableau on a Vertica database that allows for highly tuned queries. So from an analytics perspective, what you notice here on this slide shows our overall registry and measure quality scores for our MHMG employed providers. What you'll notice is that the registries and the measures associated to each registry is showcased on this slide. And you'll notice different tick marks along the way, the yellow, green, and or blue markers. Those markers are Memorial Hermann benchmarks associated to our quality performance to gauge how our physicians are doing. So from a performance indicator, are we hitting threshold measures? Are we hitting target, and or are we hitting distinguish? And those are predetermined performance measures that we establish. So you'll notice that this is an overall view for our MHMG employed physicians. The next slide showcases performance by practice. So what you'll see here is from a registry and a measure perspective, how are we doing associated to each of the measures but at a practice view. Then finally, you'll see the registry performance by an individual provider. So these are it's the same, based on each of the previous slides, it's the same registry and measures, just broken out into different views from an overall MHMG employed physician. What does it look like for the overall group? What does it look like at the practice level? And then you could continue to drill down to understand what the quality performance for our various registry measures are at the provider view. In each of these viewpoints, you have the ability to see how is the overall group doing, how is the practice doing, or how is the provider doing in regards to, are they hitting threshold, target, and or distinguish based on a very specific measure. Another one of the viewpoints that we've rolled out from an analytics perspective to support our quality programs is an incentive dashboard. So this shows a breakdown of registries and measures performance by our scorable measures. So what that means is from an incentive perspective for specific physicians, either our PCPs or our pediatric physicians, what are the specific measures that are included in their incentives? And this shows how physicians are doing individually as a provider, and then how is their group doing overall based on each of those measures. So, for example, is an individual provider at threshold, target, and or distinguish for the specific measures that are included in their incentives, and or how are they doing overall as a group? So based on the different tools that we have from the registry application itself, leveraging registry within various physician EMRs, leveraging our analytics tool sets to give us an understanding of how physicians are progressing. Are they on target, or are they distinguished based on different measures specifically? These are some of the results that we're seeing by leveraging a registry application to address gaps of care. So from an adult wellness perspective, if the average panel size that we were looking at was just a little shy of 200,000, we saw from an annual office visit an increase of 11% of annual office visits, and while the population grew 38%. From a depression screening perspective, we saw an increase in depression screenings of 8%, although the population grew 41%. And then from a blood pressure measurement perspective, we saw that an increase in 12% with a population increase of 38%. And then you can notice through adult wellness, senior wellness, or even adult diabetes, the increase that we have been able to see in percent met on specific measures over, and the period of time was over a year period of time. Slide 33 really showcases a trend of what we see from those same measures from the previous slides based on the quarter of the year, and how throughout the year from Q1 2017 to Q1 2018, how we are increasingly improving on specific measures that we are focused on. So from an annual office visit, depression screening, blood pressure management, etc., via adult wellness registry or senior wellness registry. This really shows, based on the trending over a period of time, how we were improving in closing specific measures and or addressing gaps of care. And then from an ACO contract performance, what does this mean? So as a part of our ACO, as we discussed earlier, we formed the Memorial Hermann ACO in 2012. We have various different payers that are a part of the ACO. On the top part of the screen, you'll see Payer A. These are different measures that are within our contracts with our payer, our performance contracts with our payers, and we'll notice that with 84,000 covered lives, the measure of breast cancer screening or some of the other measures associated to our A1C testing for diabetes, etc., we'll see where we were at pre some of our registry tools and where we're at post implementing our registry tools and the significant savings that we've been able to acquire based on that. So you'll see that for payer A and payer B, based on the different measures that are within our contracts with these payers and how leveraging the registry tools has helped us with true dollar savings to the organization. And then this is a viewpoint of payer C, the measures associated to that performance contract, where we are at pre-registry and post-registry and the savings associated to that. And overall, what does this truly mean to Memorial Hermann? From us starting this journey in leveraging the Healthy Intent platform, leveraging the Healthy Registry tool, being able to grow the tools to understanding how many registries and how many measures that we would need within each registry. How do we get the right information back to the physician's EMR, regardless of the physician EMR being a Cerner tool, being an ECW EHR or an Allscript EHR. How do we present the right information based on a patient's visit for physicians to be able to understand what gaps of care need to be addressed or what HCC should be attested to, has helped Memorial Hermann be able to actualize 3.7 or just shy of $3.7 million in savings. So some final thoughts. We truly believe the way that you advance quality performance in regards to addressing gaps of care, it really requires people, process, and technology. So truly understanding your clinical end users, understanding what are the processes within their practice, what are the processes and workflows within their EHR, and how do you build the technology solution to support the people and the process. And then one of our key physician champions within our MHMG employee group provided feedback that said, with continued improvements in the Smart Registry application, I have been able to use this component within Cerner to help assure that I'm addressing key health maintenance issues and helping patients remain up to date with treatment and prevention of chronic medical problems. Integration within the EHR and capturing claims data saves me time that would have otherwise been spent searching data that previously may not have been easily available. So this is the journey that we are on at Memorial Hermann, and what does it look like to leveraging various tools from a registry perspective to understand the care gaps of a patient, how to address them, to truly move forward various quality programs to achieve quality outcomes. Thank you.
Well, thank you, Eni, for joining us today and sharing the work you're doing at Memorial Hermann and your Davies story. Just want to remind the listeners where to go find other Davies use case recordings and information on how to apply for Davies. That information can be found posted at the HIMSS Davies Award website at hims.org/Davies. That's hims.org/Davies. There you can find recordings on various topics from our Davies winners. Once again, just want to say thank you and have a good day.